Steve Moran here with another episode of Foresight TV. We are going to talk about one of the most important topics today that exists in senior living, and that is the nursing home conundrum. Alice Bonner is passionate about making nursing homes into something that's wonderful instead of kind of how people see it today. So, before we get started on that, this. Hey guys, Steve Moran here. Alice, welcome. Before we get started, I want to just say that this episode of Foresight TV is brought to you by CARE. CARE is the anti-staffing agency. Staffing agency? I don't think they'd like it if I described it that way, but that's really what they are. They make it possible for you to fill your staffing gaps at an amazing low cost, low premium, and give you great people that if you love them and they love you, you can even hire them. You don't have to pay a premium for them. They are all about making your communities better, giving them better staffing at a lower cost. If you're struggling with staffing, you should be talking to them. And I would just add that if you're working in a community and you don't like it very much and you'd like to have a little more flexibility, maybe even a little bit more money, CARE is a great place for you as well. And with that, Alice, welcome.
Thank you. Very
I,
glad to be here today from Boston, Massachusetts. So I'm
uh,
on the side of the country from
well, I
you.
would say we're across the country here. It's your day is mostly almost over, and mine is just about not even quite halfway done yet. So let's start with you have this huge passion for solving a big problem, and love to have you talk about that.
Well, I appreciate that, and I would say that it isn't just me, right? I mean, we have many colleagues who've come together to address the issues, and also I want to be very clear. I've been working in nursing homes for 40 years. I started out as a nursing assistant before there was certification. So when I was in college, and the issues with nursing homes, some of them are long-standing. But what's important is that we recognize there are also some fantastic nursing homes out there, and the people who work in nursing homes, by and large, are people who want to be there, want to do this work, love working with older people or individuals with challenges, physical challenges, emotional challenges. And so there's just a lot of strength and a lot of opportunity, but there's a lot of challenges. So, nursing homes, for people in your audience who may not know, nursing homes are residential settings very often for individuals who, even if they might like to live in their own home or apartment, there's not enough support to keep them safe and for them to feel safe and have the quality of life that
So
they would
we
like. So,
got
when people have complicated or, around them all the time to support them. Yep. A nursing home is a residential setting where lots of people live together as a group on a campus, for example. And there's a higher level of support, for example, versus assisted living facilities, which some people think of as almost the same thing. And assisted living facilities have a lot less in terms of nurses who are there and things like that. They do come in, but not as much as you have available in a nursing home. So that's what nursing homes are. And there's always going to be people who need to live in nursing homes, even if more and more of us, are able to live at home in communities. But, some of the challenges are um, not a lot of people that have a positive view of nursing homes, as you said in the beginning. And we need to change that. We need to make these environments or places where any of us would feel like it's our home. It feels like our home. It's comfortable, familiar. People care about us. They respect us. They value what each person who's living there brings to the organization, and it feels like everybody's a community. Our vision is that nursing homes, every nursing home is a community in which lives are nurtured, residents who live there are empowered, and it's where people want to work. So that's our vision, and the way we're working toward that vision right now is through making meaningful changes in policy and practice by bringing diverse voices together with the power of those voices to really make changes now.
I think one of the, and you're probably going to hate this, so we'll just see how this goes, right? But I think one of the things that I really struggle with is that I fundamentally I agree with everything you say. However, so I live in California. It's been a number of years, but at one point in time, I had been in virtually every nursing home in the whole state. I used to sell contract rehab services, and so I mostly Southern California, which is where the bulk of the nursing homes are in California, but did some work even in the Sacramento and the Bay Area, and so I've been in a bunch of them. And the truth of the matter is that most of them are pretty grim. Um, they're not places that I'd want to go. There's a building that I've been to outside of Park City in the little town of Heber that is amazing. It feels like almost like a Ritz Carlton, and they actually have a nice sized population of Medicaid that they do there. They've been used some really creative financing to get the building built and to operate. I've been to an old building that's run by and for Catholic sisters in Mountain View, California. That while old, it feels wonderful place. How do we fix this quality? I think the first question is that if we're going to fix the people's perception, we've got to fix the reality of so many nursing homes.
Absolutely. And everything you said is, we've heard over and over the last year that we've been together as a coalition. That's one of the reasons we now have 1,200 people from around the country. And that might not sound like a huge number to folks when we have 15,000 nursing homes. So there's a lot more we want to see in terms of people getting engaged. But the reason those 1,200 people like you have gotten engaged is because they say to themselves, why is it this way? What are the underlying issues that have led us to this place, and how can we get around them? There's a couple of really nice historical pieces, chapters in books on aging and so forth, that kind of give a nice history of the nursing home. How did it evolve in policy? How did we get to where we are today? And for example, how did we go from nursing homes being run by faith-based organizations and volunteer types of organizations to what we have now, which is, about 2/3 of them are for-profit nursing homes. So people are, going into this as a business. And we could have a very long discussion about what people think about that. Is that the right direction? How can we manage that if it is the direction that we want to go as a country? And this is true not only of nursing homes, but I would ask the same questions about hospital systems, home health, PACE, any of those entities. So that's only one aspect, though. The other thing is, you talked about the physical plant. When you say grim, I get a picture in my mind of, kind of a dark old building. And that sadly is true of a lot of our nursing homes in this country. Many of them were built over 50, 70 years ago. The structures really need updating, and the design it's not person-centered. And people use that term all the time, so I feel bad using it in some sense, but it is an important element of care and quality of life that, if I'm the person who's living in the nursing home, I want people to ask me about what my goals are, what my preferences are, what time do I like to get up in the morning? Do I like to go outside every day? Are there favorite foods that I have? Those might sound like small things, but they're really not small things. If it's important to me, if it's important to me to have a really wonderful cup of coffee in the morning, then I want to be living somewhere where they care that I think that, they ask me, and they act on it. They do something to make sure that's part of my care plan. So to your point, again, I think part of what we have to address is physical environment. And one of our action plans, you may have seen, is specifically about funding opportunities that will enable nursing homes to do more of these conversions from the older physical plants that we have now to more modern structures that will promote having private bedrooms, private bathrooms, shared living spaces that work, etc. But the other thing is what I was just talking about, which is really the training of staff so that they have the education and the background and the culture. Susan Ryan. And the culture in the nursing home is really one of promoting person-centeredness, residents directing the care the way they want it to be directed, and other elements of what really promotes quality of life. So we have another action plan that really gets at that second element of, are we asking people about goals, preferences, and priorities? Are we documenting it in the care plan? Are we delivering it when we're delivering care? And, the overall culture in the nursing home, which again, sadly, in some nursing homes does not support those things. But the good news is in quite a few nursing homes, those things are really part of the fundamental culture, and the residents recognize that and they tell people that about their experience there. So we know we can do it. We are doing it. And part of what I'm most interested in and what our coalition is most interested in, more importantly, is bringing people together from the nursing home community. We have many, many nursing homes that are part of the coalition. And bringing them together for them to say, hey, wait a second, I'm doing those things that you think are important. We're doing that. We've integrated that, and go to those people and say, okay, let's take what you've done so successfully and bring it to some of these other nursing homes.
Yeah, so this is so fascinating to me. I've got so many things I want to talk about, and we could go for probably 2 hours. One of the things I think that makes very hard for people, both inside and outside the industry, is that the answer from many of the nursing home operators and from the trade associations is all you need to do to fix the nursing home quality problem is to give us more money.
Yeah.
And I'm not saying that money isn't a part of the problem, but on the flip side of that, when nursing homes come up for sale, it's not like people. So on one hand, they're saying we're not making any money, and on the other hand, every time a nursing home comes up for sale, there are multiple offers of people buying them, and they're not buying them because they're not making money, and so it's really hard to understand where that is. And my mom spent 7 days in a nursing home about 5 years ago. It was a 5-star building, which is one of the reasons we chose it. And from the moment we moved, they brought her from the hospital by ambulance about 7:30 in the evening. Ambulance crew dropped her off in the room and sort of got her tucked in. When they walked in, the nurses saw them and said, "Oh, she's in room 508 or whatever it was." And then we waited in there for 30 minutes before anybody even came from the community to do that. And we knew we'd made a horrible mistake. She only stayed there about 5 days. It took us 2 or 3 days to get her moved. Big fights with administration there, but mostly they made expenses. And I think too many people have that. So what role do the finance and maybe what role do the regulatory system make in terms of nursing homes the way they are, and how do we fix those problems or those challenges?
So these are great questions, and you've had personal experience as well as professional experience. So and that's really important, because when you've had a family member, I've also had family members, my mother and my father, go through that, and it changes your view. I think it's important to separate out the categories that you described, because each of them does have an impact independently, and they also have an impact when they interact with one another. Just adding more money by itself without doing anything else is very unlikely to change everything in terms of the culture in nursing homes and how we approach it. However, if we don't have adequate funding, then we don't have adequate staff. We have high turnover, meaning people don't stay in their positions. We have weak leadership because they leave and go do something else. And we're not attracting the smartest, best people, the brightest people to do this work. So we do need to adequately finance nursing homes. There's a number of studies that are in the literature that say that the amount of money, meaning dollars per day, so like the Medicaid dollars per day that each state designates as their rate for nursing homes, is not enough to cover the daily cost of care for the average nursing home, resident. And so if that's the case, you could be the best administrator, director of nursing, medical director in the world, and you're still not going to be able to deliver the quality that you want. So there are other things in terms of, as I was talking about before, the leadership training about quality, recognizing when there's a safety issue before someone gets hurt so that you can prevent injuries and things like that. The other thing is, I want to really emphasize the importance of good leadership, because, if you have a great medical director, and especially director of nursing, administrator, charge nurses or nurse managers who have been there a long time, a director of social work who's really strong, a pharmacist, these are all key positions. And you can have people who really want to do a good job, but they also need to have the experience and the dedication and the passion that you're talking about. And a lot of them do. But we have to go from just a few, ideas here and there. We have to standardize this so that all nursing homes, all 15,000, have that. The regulatory issues are brought up a lot. Because of that, we have 2 action plans that are just about the inspection process, what we call the survey process in nursing homes. And that's another place where we can get at what you're talking about, when you're saying, well, how do we change the nursing homes that are grim, and have them become really positive environments, positive home-like places. When the surveyors go in, we want them to be looking for that. We want them to say to the nursing homes that are not providing those environments, wait a second, we're not seeing this, we're not seeing that. Or in the really good nursing homes, they're saying, that's a great model, that's a best practice. Let's see if we can share that information. And the other group that shares a lot of that, those positive best practices, are the quality improvement organizations, which are called QIOs. And that's part of the federal budget. All of us as taxpayers, we pay for that program. And, what they do is, if the surveyors identify a weakness or something that they think needs improvement, the quality improvement organizations can go in separately after the survey and really work with the nursing home team shoulder to shoulder and talk about and provide training in these areas that you're considering. So, again, if we focus on the things that we think are most important, person-centered care, resident-directed living, asking people about their goals and preferences, teaching staff about how to deliver these things, that will make a difference. And so those are all things that you'll see sort of throughout our action plans. And, the Moving Forward Coalition is only one group that's doing this work. There's many others. Some of the people on the, thank you for chatting in the link there. Some of the people that are in the Long-Term Care Ombudsman program may be listeners of yours. Those are volunteers mostly across the country who go into nursing homes and work one-on-one with residents and work with staff, but they're really there to support and promote the voice of residents and what they are expressing that they need. I mentioned about the QIOs. We have other organizations like our Department of Justice. They have a whole bunch of programs about nursing home quality, and they work with specific states. So that's just another example. Certainly CMS, the Centers for Medicare and Medicaid Services, does a lot with oversight of nursing homes too. So regulatory, finance, training, and education, I would say, would be 3 really important areas that we need to fund and we need to support. And Congress needs to hear us say that, because Congress hears about lots and lots of different things that are all very important, but nursing home issues do not have a lot of champions in Congress right now. There are some, but we need more.
So I saw, I'm going to confess, I didn't read through the whole email, but I got an email yesterday that came out of Leading Age that said that President Biden is convening some sort of a nursing home task force. And I know that there's been a big push over the last 6 or 8 months, mostly perceived as a heavy-handed threat to impose mandatory staffing levels, and there's been a tremendous amount of pushback from the industry, from Leading Age, and from AHCA in particular about the mandated staffing levels. Can you just talk a little bit about that?
Sure. So you have correctly identified once again a major issue that everybody is on pins and needles about, because we've been hearing about this for close to 2 years now.
Yeah.
So CMS did ask an outside company that they contract with, who has expertise in this topic, to develop a set of recommendations for a new regulatory update around staffing. Your listeners and you may know that the staffing requirements historically in the Code of Federal Regulations that oversees nursing homes have been very general. It says something like the nursing home must have adequate staff to care for the residents that they have admitted to that nursing home. Well, that, as you can see, has lots of interpretation. That what does that mean, adequate staff? And it doesn't say anything about the type of staff. It doesn't say anything about the training of that staff. There are other elements in the regulations. When the surveyors go in, they do look for certain staffing numbers, but it's only for a period of time, typically has been for a period of time of about 2 weeks, that the surveyors look at. The CMS has done a lot lately, and I would say I'm talking over the last 5 to 10 years, to really update their staffing requirements that the nursing homes have to submit based on their payroll-based journal. So the nursing homes cannot just submit anything they want. They have to submit the employment records to demonstrate these people were actually there. They also have to do more in terms of, okay, so if I'm a registered nurse, if you're employing me in the nursing home and I'm a registered nurse, am I actually working with the residents who live there? Am I working with the nursing assistants and the other nursing staff, or am I in a back room somewhere doing a lot of paperwork? And it varies. So those are the kinds of things CMS has really been focused on. But when the report was drafted and sent to people for professional folks to review it, people with lots of expertise, I think there was concern that, and again, this is all third hand, so I'm just telling you what I've heard from colleagues. But there was, I think, concern that that there would be an outcry if there was too much of a requirement for staffing for hours per resident per day, which is how we typically calculated it. So how many hours of a registered nurse, how many hours of a licensed practical nurse, how many hours of a nursing assistant would each resident get on average in that nursing home? And again, there, people like Charlene Harrington, who you probably know, she's California based, but she does national work. They've looked at these numbers. So I think CMS took the report back because they had reviewers who were so concerned that they wanted to get it right. And they've said to a lot of people, we want to get this right. They're trying to solve a problem. They're not trying to lower the hammer. They're not trying to say, oh, this is about just increasing requirements for staffing. This is about making sure that as much as we can, we have smart, stable regulations that are going to help people living in nursing homes get the right care, because the staff people are there to do that. So I don't have any more insight in terms of when that report will come out. We hear it's going to come out in the fall. Don't know. But I think, everyone who really cares about nursing homes, which is hopefully everyone who's listening in on this call, they're going to look at that report. They're going to read it. They're going to think about it and figure out, okay, so how will we use it to really improve the situation that we have now? I'm sure you're thinking about, how are we going to pay for this, right? And that's, a lot of what people who run nursing homes are saying too. They said, I would hire all these staff people if I could, but I need to be able to pay them a living wage, or, whatever the going rate is. So part of it is that, where does the government find that money, and where do the states find that money if some of it's coming from the states?
Well, I think the money is part of it, but I think the other part of it is that if you have mandated staffing and all of a sudden you've got to collectively across the country increase the number of hours that take place in a nursing home by 30%, even if you can pay for where do you find the caregivers who are going to be able to who are capable of delivering that care, right? And so it's a double pronged approach. I have to believe, and I think from a regulatory standpoint, that CMS is ultimately, if they're going to require increased staffing, they are going to have to figure out how to pay for it. They can't just impose the staffing without paying for it. And I'm actually one of those people, even though I'm in the industry, and don't tell anybody I said this, but I actually think that the mandated staffing is not such a crazy idea if you can figure out how to actually make it. You've got to be practical. And my struggle is that I feel like the regulatory system is not very practical. So as there have been abuses, and there have been real abuses, there's no question that that's true. CMS's answer has consistently been to use a bigger hammer, higher fines, and it hasn't worked. It has made it's made nursing homes find it a necessity to appeal and drag out because the process is so draconian. And so I keep finding myself thinking that somehow we've got to start with almost a clean sheet of paper on the regulatory process and build up from ground one so we have common sense. I look at California, it's not perfect on the assisted living side, but what I see here in California is a pretty collaborative effort between community care licensing and the operators, both for profit and not for profit. And because the goal for both sides is to make it better for residents, and it oftentimes doesn't feel like CMS cares about that. They're listening to I want to punish the nursing homes crowd and not the operators.
Yeah, so it's very true that there's a lot of controversy around those things. And one of the reasons we came together as the Moving Forward Coalition was to say we can have a real conversation, even though there are people who are going to violently disagree with one another. And we've had those, trust me, because I moderate them. So I leave and I like need to, go on to the next day's work. But we've had some really difficult conversations, and we've brought together advocates. You probably know Tony Chicotel from Canner and Toby Edelman from Center for Medicare Advocacy. These are people who do national nursing home advocacy work. We've brought those people together with nursing home owners and operators. You mentioned ACA, Leading Age. We also work with AMDA and NADANA, these other organizations. Sorry for all the acronyms. But you are correct. We need to have a balance. And I'm one of the people like you. I want the fresh sheet of paper. I just want a blank page that we can start again from scratch and say, let's build this the way we want it to look and get rid of all the old regulations that are outdated. And, CMS will admit that there's a bunch of them, and let's keep the ones that are good. And let's get really good policy developers and regulators who know how to write good regulations. And let's get together and let's redesign the system, because unless we redesign that system, we're going to be stuck with some of these fatal foundational flaws. And again, I don't think anybody wants it, and CMS doesn't want it either, but there needs to be activation energy for something as big as what you're talking about and I'm talking about, because it's millions and millions of dollars. It's not a chip shot, but it can be done. And in my opinion, I agree with you. I think it should be done.
Yeah, it's what you make a really good point. So, it's hundreds of millions of dollars, maybe billions of dollars. And when you change the system, there are going to be some people who are going to lose out in that, right? And those people are going to fight to hold on to it. And so I think that that's a realistic point of view. So I got a couple more questions. We're about out of time. The first question is how do people get involved with what you're doing?
So very easy is your associate kindly put on, there we go. If you go to this website, if you don't copy it quickly enough, you can just put in your search engine, Moving Forward Nursing Home Quality Coalition, or just Moving Forward Coalition, and it'll pop right up as the first hit, most likely. And then when you go to the website, you can, cruise around the different pages. The action plans are on the Taking Action page. And on almost every page, there's a big button that says Get Connected. If you click on that, send us your email address and your name and anything about you, like what you're interested in. We'll add you to our distribution list. We send out very, very few emails. We send once a month our newsletter. Other than that, if there's an event or something, particular new policy that's critical, but you don't get a lot of emails from us, but you will stay connected. And we just encourage people, check out the website, click on Get Connected if you'd like to, and otherwise just follow along with us because we have work going on in all of the states. We have teams in Michigan and Pennsylvania in particular, but lots of activity in your state as well.
Here's my question. Dream for me big. Dream for me big what nursing homes are going to be like in, I don't know, 3 to 5 years.
Oh, I thought you were going to say like 50 years.
No. 50 years, I'll be dead. I don't care.
I know, we'll both be dead. So, in 3 to 5 years, I would love to see us working on the transformative regulatory, the Code of Federal Regulations. I just think it needs to be redone in a way that can really help support the work. I think certified nursing assistants and nurses and social workers and medical directors who work in nursing homes and administrators all need to have their salaries and benefits looked at. Certified nursing assistants are horribly underpaid. They get no benefits in many cases. And it's just not a job that people can support themselves or their families in many cases. Kudos to the nursing homes that are paying a living wage or more than the minimum wage. Thank you for doing that. But we need to see that happens everywhere. And right now, most nursing homes are not there yet. So we really need to work with the Department of Labor, workforce, centers, and the federal government and state governments to address that. So those would be my 2 wish list items that I think would make the biggest difference.
I love that. My friend Lori Alford, who's the COO for Avante Senior Living, I think COO, I apologize if I got that wrong. She talks about making senior living sexy. And so you're really just talking about an extension of that, of making nursing homes sexy. And sexy for places to work, sexy for people to live. I mean, I don't think you can ever make a nursing home big enough where anybody says, I can hardly wait to get to a nursing home, because you go there
Why not? You said dream big. Let's go for it.
But why not? Maybe. I will tell you, if you go visit this place outside of Park City, it's pretty amazing. I looked at that. I spent a couple hours there and I thought, man, I could live here. So I think even that is
that's the key. That's the key.
Alice, thank you very much. I love your passion for making the industry better, for making lives for both the people working in the industry and for the residents better, really the families better. It's what our complete mission is at Foresight, is to do that. I want to say thanks to Jada, who you actually never get to see, but she runs everything behind the scenes. So all that stuff that gets popped up and the changing views is amazing. And of course, if we all blew up, she'd be the last one left to run things. And so again, Alice, have a great weekend. All of you have a great weekend. Thank you for what you do in making the lives of people who live and work in senior living. And with that, we are out of here.